intratunnel phacofracture, a new MSICS technique. A fornix-based conjunctival flap at the limbus with a chord length of approximately 6.5 mm is made. After careful dissection of the tendinous capsule, light cautery is applied. A 5.5 mm scleral frown incision, 1.5 mm from the limbus, is made with a 15-number barred Parker blade. A funnel-shaped sclerocorneal pocket incision is created with a steel crescent knife. With a 2.8 mm keratom, the anterior chamber is entered 1.5 mm into the clear cornea. Lens capsule is stained with trypan blue. HPMC viscoil SICS is injected into anterior chamber. The central circular capsa or hexis is made with help of 26 gauze needle capsatum. The internal incision of the tunnel is enlarged sideways to 6.5 mm with a 5.1 mm keratom. The hydrodissection is made with 26 gauze cannula placed on 2 cc syringe-filled irrigating fluid. The nucleus is rotated within the capsule and prolapsed into anterior chamber using a Sinskey hook. Enough viscoelastic was placed between cornea and superior surface of the nucleus to protect endothelium. Lewis lens loop is introduced through the tunnel and positioned between the iris and the nucleus. The nucleus is engaged in the lens loop and slowly withdrawn from the anterior chamber, while the posterior lip of the tunnel is depressed. Once the nucleus is engaged in the tunnel, then the Lewis lens loop is pulled posteriorly and upwards. This causes breaking and removal of a part of the nucleus, and other part remains engaged in the tunnel. By viscoelastic, the engaged part of the nucleus was pushed back into anterior chamber, and rotated so its longitudinal axis was coincided with long. Lewis lens loop is introduced through the tunnel and positioned between the iris and the nucleus. The nucleus is engaged in the lens loop and slowly withdrawn from the anterior chamber. The remaining cortical matter is cleaned up with direct 23-gauge Simcoe irrigating aspirating cannula. The AC is formed with HPMC viscoelastics. A single-piece PMMA intraocular lens is implanted into the capsular bag. The AC is washed out thoroughly by Simcoe cannula using Ringer S lactate solution. Tunnel and side ports are sealed with hydration. The conjunctival flap is reposited back and cauterized at the edges. Now we are going to demonstrate how easily a rock-hard, large nuclear cataract is taken out through 5.5 mm tunnel by intratunnel phacofracture technique of the MSICS. Such type of cataracts are difficult to conquer even with high-end phaco machine. Intratunnel phacofracture technique is more safe, as compared to other nucleotomy techniques, as maneuvering takes place inside the corneoscleral tunnel, not in the anterior chamber. It is simple and inexpensive technique. In next video we are going to watch how a hypermature senile cataract with large nucleus is taken out through 5.5 mm tunnel by intratunnel phacofracture technique of MSICS. This surgery was done under topical anesthesia. By intratunnel phacofracture technique of MSICS, All type of the cataracts like mature, hypermature, large nuclear can be taken out from 5.5 to 6.0 mm corneoscleral tunnel. As maneuvering takes place inside the corneoscleral tunnel in contrast to other methods of the anterior chamber nucleotomies, where maneuvering takes place inside the anterior chamber. So intratunnel phacofracture technique is safer than the other nucleotomy techniques. Manual small incision cataract surgery or MSICS is significantly faster, less expensive and less technology dependent than phacoemulsification. MSICS has been extensively practiced in developing countries like India. The most commonly practiced MSICS techniques are Blumenthal, visco expression, irrigating wire vectis and fishhook needle. These techniques require a 7 to 9 mm large incision, which leads to more astigmatism. According to several studies in the literature, if nucleus is managed to remove, though a sub 6 mm corneoscleral incision at appropriate site would result approximately same astigmatism as 3.2 mm phacoemulsification. We sincerely thanks for watching this film and sparing your time.